I'm Dr. Phillip Bostian. I am an orthopedic hip and knee replacement surgeon here at EmergeOrtho. We do about 90% hip and knee replacements, mostly for patients with arthritis, although commonly we treat patients who have fractures or other conditions of the hip and knee that require joint replacement. Joint replacement has come a long ways, especially in the past few years. I use a robot for knee replacements, and the benefit to the robot is that we can really dial things in to a 0.5 millimeter or 1/2 degree. With conventional techniques, it used to be that we could really give you a great knee replacement, but we might be off by a degree or a millimeter here or a millimeter there. And really what we try to do is take what we felt were great knee replacements and make them perfect knee replacements. And the robot really enables us the ability to do that within a 1/2 degree or a 0.5 millimeter. We prototype the entire knee before we ever make a cut. It used to be that we would make the cuts and then we would adjust the soft tissues around the knee replacement. Now we can make a prototype of the entire knee replacement before we ever make the cut. We can adjust the implants. We know exactly what that's going to look like before we cut. You know, the old adage is measure twice, cut once, and we're really able to do that now with the robot. It's really enabled us to do that. On the hip side of things, you know, hip replacements generally do very, very well. But we still have some issues with dislocations and instability, some issues with leg lengths and one leg being longer than the other. And so we're using technology, and it's really the first of its kind that uses augmented reality. So I use a set of goggles that overlays the patient's anatomy onto the patient's body and the patient's skin. And it's really a lot like having X-ray vision. So we get a CT scan before surgery. We can template and prototype exactly where we want that hip replacement to be. And then I can line that up with my template that I made prior to surgery to the patient's anatomy through augmented reality. It's almost like having X-ray vision in a sense. And so we can take what are really great hip replacements and we can make them perfect. We can put the implants exactly where they need to be, and exactly where we want them, and we think as a result we have better outcomes. If we're looking for a hip replacement to last 20, 30 years, it needs to be perfectly positioned. So it may be that the patient's happy with the hip replacement for the first 15 years of its life, but then it fails because it wears out too soon, because the components weren't perfectly positioned. But if we can get them in the perfect position, we can really optimize the longevity of the implants, the outcome of the implants, and we can minimize any associated complications or mechanisms for failure. So I've always had an interest in how we can use these technologies in the operating room. The technologies have been there, especially in terms of robotics, for a while, but we didn't have a way that they made us better. Just because you can do a knee robotically doesn't mean that it improves outcomes. It doesn't mean that it makes the experience better for the patient. But really the technology has advanced in such a way that I do think it changes the outcome for the patient. I do think the patients can get up and go faster. There's no surprises with robotic knee replacement. We know exactly what that knee is going to be. And I think that changes things for the patient. It changes things for me. I know when we leave that operating room, that knee is as good as I can make it. I have every confidence that that knee is as close to perfect as I can get it, as close to the parameters that I want it to be before we leave the operating room. We never have surprises afterwards. I didn't think it was important to just bring technology to the operating room for the sake of having technology. I thought it was important to have that for the sake of having better outcomes. And the technology that we have now, I really think improves our outcomes, and that's why I use it. I've had first access really to a lot of this technology in North Carolina. The only other site that's using this actively is Duke University. So we really are at the forefront, cutting edge of this technology. This is places you're only going to see this technology in places at large universities, places who are really cutting edge. That site is here, and I have to say, you know, our practice and our hospital has also enabled us to obtain this technology and worked with us to get it as soon as it comes out. You know, we are the first phase of this, and it's really helped us not only to implement and help our patients, but we also are going to help develop the technology. You know, it's really in its infancy, and we see the value of it, but as we continue to move forward and this continues to evolve, we're going to be a part of that discussion. We're going to offer tips and hints and tricks and we're going to have a hand in the design of the technology as we move forward. I think historically a lot of people have felt that maybe you need to leave town to get the best, newest, greatest thing. That is no longer the case, and we can rival any outcomes any place else. We have everything available to us that any other surgeon in any other city or town has, and so we can do everything right here in Hickory, North Carolina. You don't have to leave town to get great care. We can do it well. In my opinion, we can do it better than a lot of other surgeons, irrespective of what town or city they may live in. We can do it very well right here. So we can be very confident that when you choose EmergeOrtho for your joint replacement, you have expert care right here in your hometown.